ecdc On Air,
the podcast of the European Centre for Disease Prevention and Control.
Keeping up to date with European epidemiology.
Hello and welcome to ecdc On Air. Today is the annual World AIDS Day, and we have Teymur Noori with us, who is an expert on HIV here at ecdc. He's going to speak to us about the state of HIV/AIDS in the world, and in particular in Europe. We're going to take a closer look at how much progress has been done so far, what issues that Europe is facing, and what remains to be done in order to reach the goals set. So, hello Teymur, and welcome to ecdc On Air.
Hi Niklas, thank you for having me. It's a pleasure to be here today.
I wanted to start off just asking you, can you explain to our listeners what you do at ecdc and what's your background?
Yeah, sure. So I've been at ecdc since 2007. I'm a trained psychologist. I studied in both Chicago and London, and a lot of insights around the behaviors around the transmission of HIV and AIDS. That's why I got interested in this subject area. And then before starting at ecdc, I worked at the National Institute of Public Health in Sweden, supporting them, monitoring their HIV national action plans, and got recruited in 2007, as I said, to ecdc to work around issues around monitoring and evaluation.
Can you explain to us what is the state of HIV/AIDS right now in the world?
Yes, sure, of course. So, globally, so this is data coming out from UNAIDS. So basically, UNAIDS estimate that approximately 38 million people are living with HIV currently, globally. And out of those, approximately half of those live in sub-Saharan Africa, or rather in Eastern and Southern Africa. 20 million people were estimated to be living with HIV in Southern Africa, followed by Western and Central Africa and Asia and the Pacific. So it looks very different in different parts of the world. But as I said, 38 million people are estimated to be living with HIV. And in 2019, I think approximately 1.7 million people were newly diagnosed with HIV. So it's still a significant problem globally. A lot of people are still being infected, and approximately 690,000 people died of AIDS-related deaths in 2019. So it's a significant issue still.
I understand, okay. But looking back in the early days of the HIV pandemic in the 80s, I mean, it was more or less like a death sentence, right? And I understand now that there are much more effective treatments and so on. Can you say a little bit about the difference between what the situation is now as compared to 30 years ago?
Yeah, well, as you said, the biggest difference is of course, the issue of treatment, which came in the late 90s, which was a huge game changer. We are still scaling up treatment. We haven't reached the levels where we should be, but in the late 90s, when the new treatments came, that was a huge relief for the global HIV community, where we were able to put people on treatment. So that is the biggest game changer we've had, of course. But lots of things are different now from then, but that is the most impactful change that has happened, absolutely.
And looking then a bit more specifically at Europe, because that's what ecdc is focused on and what you're focused on in your job. Can you tell us a bit more then? What are the specific issues? Yeah,
so the new HIV report that we released with our colleagues from WHO Europe yesterday, we estimated that approximately 2.2 million people are living with HIV in this wider WHO European region. It looks very different depending on which region you look at. In the western parts of the region, approximately 16% of all diagnosed cases occur. That drops to 5% of diagnosed cases in the central parts of the region, and a full 80% of all diagnosed cases still occur in the eastern parts of the region. And as to your questions on the transmission modes, they also differ very much. So in the western and the central parts of the region, approximately half of all diagnosed cases occur among men who have sex with men, followed by heterosexual transmission both among men and women, and approximately 4% of all diagnosed cases among injecting drug users. Whereas in the eastern parts of the region, it's driven by heterosexual transmission, both men and women. A significant proportion among people who inject drugs is 24%, and sex between men is drops to approximately 4% in the eastern parts of the region. So big differences in terms of transmission modes in our region. And also a really important factor that I want to stress is this issue of migration, whereas in the western parts of the region, almost 50% of all diagnosed cases occur among migrants. That drops to 10-12% in the center and roughly 1% in the eastern parts of the region. So this issue of migration is really, really important in terms of developing prevention and treatment programs. This issue is an issue that we've looked at for the past couple of years to try and really understand if migrants come to the EU already infected with HIV, which I think a lot of HIV programs have assumed over the years. But the data that we have from more and more countries now, from our own studies working with countries, is that a significant proportion of migrants actually contract HIV after they've arrived to the EU. So there's been some important studies funded by the European Commission estimating that approximately 63% of all migrants who took part in this study got infected after they arrived to the EU. Those numbers are higher when it comes to men who have sex with men and people who inject drugs from other countries, and also depending on where migrants come from. So especially migrants from Latin America and the Caribbean, as well as from Eastern European countries, seem to be at higher risk for contracting HIV after they arrive to the EU. This is really important because I don't think a lot of programs are tailored towards developing prevention programs targeted to these groups. I think historically, prevention programs have assumed that migrants are already infected when they come to the EU. But this data that's emerging shows actually that migrants are much more vulnerable after they arrive here. And this is something that we need to address as a whole.
Can you tell me then a little bit more? Do we see any particular trends?
Yes, so in terms of new diagnosis, we see really important trends. So it's important to distinguish now. The latest data that we just published yesterday actually shows a sharp decline, 24% decline in new diagnoses between 2019 and 2020. We have seen a decline over the past 5-6 years in our region, especially in the EU, of course. But this decline is quite steep now in the wider European region as of 2019 and 2020. And we believe, of course, that the whole situation that's going on with COVID has impacted numbers quite significantly. And based on the data that we have received so far, countries are reporting that that testing services has declined in many countries, and therefore probably a large part of this significant decline we see in the last year is due to testing capacities in countries, and that has been limited. So that's really important information that will take some time for us to really disentangle. So in the next couple of years, we'll try and really understand what these declines, how they can be explained. But as I said, we started to see declines in the EU since 2015, 2016. But in the wider European region, we are still seeing an increase.
There's a lot of talk about the Sustainable Development Goals, and there's also goals that have been set for Europe, specifically, as I understand it. Can you tell us a little bit more about these goals?
Yes, so the Sustainable Development Goals is really important. Were adopted in 2015. Goal 3 specifically mentions health and well-being, and Goal 3.3 is where there is talk about ending the epidemic of AIDS by 2030. Now, UNAIDS is the body that have defined what it means to end AIDS by 2030, and they've developed so-called SDG targets. And the 3 building blocks, the 3 major targets, relates to seeing 0 new infections by 2030, 0 AIDS deaths by 2030, and 0 discrimination by 2030. And in order to measure progress towards these targets, they've developed something called fast-track targets. So by 2020, they want to see a reduction in new HIV infections to fewer than 500,000. They want to see a reduction in AIDS-related deaths to fewer than 500,000, and they want to see an elimination of HIV-related stigma and discrimination by 2020. So these are the targets that were set for us for 2020, and now we're at the stage where we're trying to see where countries are based on 2020 data. So that's the data that's trickling in now, and that we're trying to make sense of. So when it comes to specific targets for Europe, so we do see, an incidence target where they want to see a reduction in HIV incidence by 75% using 2010 as the baseline. They want to see that at least 3 million people globally are on PrEP. There is no specific target for EU, and we're discussing with UNAIDS whether or not we should have such targets. And of course, these 90 testing and treatment targets, they apply globally as well as regionally.
And these targets that you mentioned, how far are we away from actually reaching them?
Well, that's a really important question that we are working very hard on to understand. I think we have really good data when it comes to incidence and the 90 testing and treatment targets. If I can just start on issue of PrEP. So pre-exposure prophylaxis is a really effective intervention to prevent the transmission of HIV. And this is something that we're monitoring quite closely in Europe today. As of October this year, 21 countries of 55 in Europe and Central Asia have made PrEP nationally available and fully reimbursed. A further 14 countries have made generics available where people can purchase them in pharmacies from anywhere between 30 and 60, 70 euros a month. And then we have a significant number of countries, 20 countries, where PrEP is not available at all in terms of formal availability of PrEP. So this is an issue that is a really important issue today in terms of trying to address the HIV epidemic. Two really important trials came out in 2015, the PROUD and IPROGAY trials showing that PrEP reduced HIV incidence by 86%, significant impact. In 2016, the European Medicines Agency approved PrEP for prevention, and since then it's all about scaling up implementation of PrEP. And in many countries in the western parts of the region, PrEP is now available and fully reimbursed, whereas in the central and the eastern parts of the region, they have many more challenges in terms of implementation.
When you mention PrEP, how does it actually work? Would it be given to all people that are in risk groups?
Well, so PrEP is highly effective for people at increased risk. Today, one of the problems that many countries face is that we are not reaching enough people, and those people we are reaching mostly belong to the category of men who have sex with men, which is really important for the western parts of the region, as they are the population that are carrying the brunt of the HIV epidemic in our region. So, but countries are facing challenges when it comes to reaching other populations such as sex workers, migrants, people who inject drugs, trans people, etc. So many major challenges in terms of reaching other groups than MSM in the western parts of the region, and in the central and eastern parts of the region, very few people have access to this intervention.
Just going back to what we were talking about earlier about the goals, what issues do you think need to be addressed in order to reach these goals? What do we have to focus on the most?
Yeah, well, I think I talked about the PrEP goals, and I think what's really important now is to focus a little bit on the so-called 90 testing and treatment targets. So, for those that are not aware of what these targets are, UNAIDS have modeled that 90% of all people living with HIV need to be diagnosed by 2020, and out of those that are diagnosed, 90% of those should be on treatment, and out of those on treatment, 90% should be virally suppressed by 2020. these targets need to be met by 2020 in order to put us on track to reach the goal of ending AIDS by 2030. So looking at the first 90 on people living with HIV who have been diagnosed, the average in our region is 82% of all people living with HIV that are aware of their status, that they have been diagnosed. So that gives us an estimate of around 18% that are living with HIV who are not aware of their status. And this is a really important group to reach, because if you're not aware that you're infected with HIV, you can't take measures to take care of yourself, but also to stop the transmission of the virus. So again, certain parts of the region, like in the western parts of the region, we've reached this target already. We've reached the 90 target in the west, whereas that drops to 87% in the center and 77% in the east. So again, when we talk about these numbers as a region as a whole, we may be doing okay, but when we look at sub-regional differences, they may differ quite dramatically. So for that first 90, that's actually where the least difference is, but still there is a difference between 90 in the west and 77% in the east who have reached this first target. But I also want to mention something that's really important in the data that we just released yesterday, is this issue of late HIV diagnosis. So out of those that are diagnosed, this issue of late diagnosis is really, really important. We haven't seen a significant drop in the rate of late diagnosis in our region over the past decade. It's been persistently high, around 50%. Women are diagnosed later than men. People living in the center and the eastern parts of the region are diagnosed later than people in the west. The older you are, the more likely you are to be diagnosed late. And heterosexual men and women are diagnosed later than men who have sex with men. So this issue is really important, because if you are diagnosed late, your outcomes in terms of both morbidity and mortality drops. So you get worse outcomes, and you're more likely to die if you are diagnosed late. So this issue is really a critical issue, and one that could be addressed through improving our HIV testing programs. So we need to make testing programs more accessible, bring testing to the communities that are most affected, try new innovative approaches. Community-based testing delivered by non-medical staff is an issue that has been discussed. Self-testing is a really great option for people to get diagnosed, etc., etc. So that's one of the key priorities in our region, is to improve our testing programs. And just quickly to move on to the second 90. So once you are diagnosed with HIV, or you put on treatment. So the clinical guidelines from both WHO and the European AIDS Clinical Society says that we should be putting people on treatment as soon as they've been diagnosed. Currently, 84% of all people that are living with diagnosed HIV are on treatment. So again, a pretty high number. It's not at 90%, but it's a pretty high number. But again, huge differences between our subregions. So 95% of all people living with HIV that have been diagnosed are on treatment in the western parts of the region, and that drops to 78% both in the center and the eastern parts of the region. So as I said before, most countries have adopted these clinical guidelines to test and treat, put people on treatment as soon as they've been diagnosed. But the problem occurs actually on the implementation side. So we've adopted the policies, and now we're still working on the actual implementation of these treatment guidelines.
And you mentioned as well discrimination, that it's one of the targets to have zero discrimination. Can you tell us a bit more about the stigma that people living with HIV/AIDS are facing?
Yeah, so stigma is one of the building blocks, one of the key targets of the Sustainable Development Goals. And that's really all the data. We have pretty good data, I would say, at ECDC when it comes to most of these targets. But when it comes to stigma, it's really a problem area. We don't have much data on this at all. We know that stigma is very high in communities, people who are living with HIV, but also people who are at risk for getting HIV. And stigma is a major barrier to effective prevention programs, to reaching people with testing, to reaching people with treatment and other services. And as I said, we have a major gap in this area, and it's this year, actually in 2021, ECDC reached out to colleagues in the community and to the European AIDS Clinical Society to see if we can do something jointly to improve our understanding around stigma and discrimination. So actually right now we have a survey ongoing across Europe and Central Asia with the community-based organizations to try and understand better the experienced stigma that they have faced in healthcare settings, but also in their private lives. And that's a survey that runs until 9th of January. So hopefully that's the first step for us to really improve our understanding of stigma in the community. And as soon as we're ready with that survey, we're going to work with the European AIDS Clinical Society to try and measure HIV-related stigma in the healthcare setting. And that's also a really important issue. A lot of people are facing stigma in the healthcare setting, and we want to work with our clinicians to try and understand what that stigma looks like and what we can do to address the issue of stigma and discrimination in the healthcare setting.
And the end goal, obviously, then is zero AIDS deaths. Do you think this is a realistic goal? I mean, what's your look on the trends that are now? I mean, we have 8 years left until 2030. What does it look like?
Well, I mean, it's really difficult. In some aspects, there's some really good news. In other aspects, we have major challenges, I would say. I told you before about the incidence target. So they want to see a 75% reduction in new infections by 2030. By 2020, and so a 75% reduction. And currently, we are on a 56% increase since 2010. So we're going in the complete opposite direction when it comes to new infections in the European region. So that is a major challenge in terms of trying to reach these targets. So and then when it comes to these 1990 targets, which ultimately, putting people on treatment in retroviral suppression is going to have a huge impact on the epidemic. And again, looking at our region as a whole, huge differences. So in the western parts of the region, we have reached these 1990 targets already, but that is not the case when it comes to the central and eastern parts of the region, where only 60 to 65% of all people living with HIV are on treatment, and that number should be at 81%. So, I usually show UNAIDS data when it comes to treatment coverage. So UNAIDS estimate that approximately 70 to 73% of all people living with HIV are on treatment globally, but that number drops to 69% in our region in Europe. So we're actually below the global average when it comes to putting people on treatment, which surprises a lot of people. But again, it's important to distinguish between different subregions within our regions. As I said, in the western parts of the region, we have reached these targets, whereas in the eastern parts of the region, we haven't. So really, in terms of trying to achieve these overarching SDG, the Sustainable Development Goals, I think we have some major gaps to reach these goals. As I said, I talked about the new infections. We really need to curb the new infections in our region, and to do that, we need to scale up prevention programs, and that includes condoms, it includes pre-exposure prophylaxis, it includes opioid substitution therapy and needle syringe programs for people who inject drugs. All these interventions need to be scaled up in order to stop the flow of new infections, which is going in the wrong direction in our region. I talk about diagnosis and the testing gap that we have in this region. So 1 in 5 people living with HIV in Europe are unaware of their HIV status. So that's 20%. So we need to do much better in scaling up our testing programs. I also mentioned the fact that 50% of all people that are diagnosed late. So we need to do much better on diagnosing people much quicker. And to do that, we need to scale up our testing programs using these innovative approaches that do exist. The third gap that I see is related to treatment. So 1 in 3 people living with HIV in Europe are not currently on treatment. So as I said, most countries now have adopted the WHO and the European AIDS Clinical Society guidelines on putting people on treatment as soon as they are diagnosed, but yet 30% or more are not on treatment. And also this issue of putting undocumented migrants is one key population that will not be seeing these targets, because in roughly half the countries that provide data to ECDC, undocumented migrants are not even entitled to treatment. So that's another gap area that we need to be addressing. And finally, I think the last gap, which I've mentioned a little bit already, is this issue of stigma. We really need to, that's probably going to be the target that's going to be most difficult for us to address. Not only because we don't have good understanding of stigma, but that's really a difficult societal issue to address, and no magic pill will help us address the issue of stigma. It's going to take time, and we're at the stage now where we're really trying to get data on that can be compared between countries when it comes to HIV-related stigma.
Do you find that there's enough political will in order to realize all these ambitions and all these approaches that you mentioned that seem to be very effective and could be so much a kind of game changer in terms of reaching these goals?
Yeah, well, I think you need to answer that question, you need to look at the data. You need to look at the maps that we're presenting. And in many countries in the western parts of the region, I think we are on track to reach these targets, doing very well in many countries in the western parts of the region, whereas we're doing very bad in the eastern parts of the region, where a significant proportion of people don't have access to PrEP, to testing, to treatment, and therefore will not be reaching viral suppression, etc., etc. So in terms of, to answer that question, I think there is political will in certain countries, and in other countries that political will is lacking. And we know what political will could do. If there is strong political will, we can address many, many important issues. And I think COVID has shown that once the will is there, once there is a concerted effort to address something, significant changes can be made. So both yes and no to that question. Some countries are doing very well, whereas with political will, whereas others have major challenges.
I just wanted to go back. We had a brief discussion about it earlier, about the COVID-19 pandemic and the effect it's had on the HIV/AIDS situation as well. For example, access to services and testing. We've seen a decline. Has there also been any other effects? Can you elaborate a little bit more on this? Because I think it's very interesting.
Yes. So earlier this year, we sent out some questions to our HIV networks across Europe and Central Asia to try and really understand what impact COVID is having. And we've got some really important data back from countries showing that COVID is actually impacting all stages of the continuum of HIV care, everything from prevention to viral suppression. Several countries, almost 80% of countries responded that HIV testing has been impacted, both in the community but also in clinic testing. So the vast majority of countries are seeing significant reduction in the capacity to test people. Several countries, around 60 to 70% of countries, reported that HIV prevention programs have been reduced, less funding, less outreach, less support to NGOs, which will have an impact on condom distribution, needle and syringe programs, the provision of PrEP. So a lot of the programs around prevention have been impacted also. And also, surprisingly, to a certain degree, more than 50% of countries reported that their treatment programs have been affected. So it looks like COVID has had a huge impact on the provision of HIV services in our region. Also, we asked our stakeholders whether or not resources have been diverted from the HIV response to COVID during the pandemic. And again, more than 80% of countries reported that human resources for monitoring and surveillance had been diverted to COVID away from HIV. Same number for clinical services, where a lot of the HIV doctors have been pushed away from their HIV clinical work to work on COVID. The same goes for lab capacity and prevention services, etc. So it looks like the impact has been quite significant. I think what's really important going forward now is whether we will see these HIV services return to at least pre-pandemic levels in the next year or so, and what will be the lasting impacts of reaching the sustainable development goals. These are two questions that we'll be looking very closely at in the following years to see what impact it has on, because we have really good measures, as I talked about, on where we are progressing towards these targets. And now with COVID, we'll see what the actual impact is and how quickly we can come back to the levels we were pre-pandemic. Those are the two major issues I think we will need to be discussing going forward.
Well, thanks a lot, Teymur. It was really interesting to hear your views on all this and to understand better how we can end this HIV/AIDS epidemic once and for all. So I hope to have you here on the show at some other point in the future.
Thank you so much, Niklas.
We hope you enjoyed this insight into ECDC's work. If you would like to know more, please visit us on the web at ecdc.europa.eu or follow us on social media for the latest news.